ديت ان احنا نلتقي مع الاخوه الاساتذه والزملاء والطلبه اللي معانا. الموضوع بتاعي يعني اكزاكتلي ان شاء الله 25 دقيقه، فيعني يور اتنشن بليز. انا هحاول اعمل بس كده يعني هل ممكن تشوفوا البوينتر هنا؟ طيب لما يجي الوقت كده. لو تبدا لي المحاضره على طول.
Greetings from Mansoura University. Is Dr. Muhammad Borg. Title is Neuro Cases. Seven-year-old boy. T2. Enlarged CSF space in the sylvian fissure over the convexity. Over the convexity, enlarged CSF space. Enlarged CSF space over the convexity. Here you can see there is atrophy of the basal ganglia, putamen, and caudate nucleus with hyperintense signal. T1 weighted image. T1 weighted image. T2 weighted image, again signal in the basal ganglia and caudate nucleus, and enlarged CSF space over the convexity and over the convexities and the sylvian fissure. Some degree of hydrocephalus is seen with a stretched corpus callosum. Enlarged anterior temporal CSF space. Diagnosis: glutaric aciduria type 1. This is some sort of leukodystrophy. Differential diagnosis in this case is enlarged, benign enlarged subarachnoid space. It is the same, but the CSF space in the sylvian fissure and in the over the convexities it is not enlarged, and also is not enlarged in the anterior temporal region. The second differential diagnosis is non-accidental injury. In both cases we can have subdural hematomas, but of course in non-accidental injury will not have changes in the basal ganglia. Second case is 4-year-old boy. Here is a mass on T1 weighted with contrast. Here is a mass in the hypothalamic region. Hypothalamic region mass, not enhanced, non-enhanced hypothalamic region in the post-contrast T1. And this is sagittal T2. The lesion is hyperintense mass in the hypothalamic region. Hyperintense mass in the hypothalamic region. On FLAIR image, on T1 was contrast, there is no enhancement. This is T2 and the T1 weighted image. There is abnormal signal, especially in T2. Differential diagnosed hypothalamic mass. The key point here is that there is no enhancement. There may be alteration in signal, but there is no enhancement. Next case is 3-year-old girl. There's large mass here on T2 weighted image. Here you can see there's some ependymal nodules. If one also can see here there's subcortical and cortical tubers or nodules. Here the mass again in T2 weighted image. There's more of the cortical and subcortical tubers and also very small nodules here, subependymal nodules. Large mass at the region of the foramen of Monroe. Again, FLAIR image. Yes. Nodules, subependymal nodules. Again, the mass at the foramen of Monroe. Large mass at the foramen of Monroe. Again, the cortical and subcortical tubers. Cortical and subcortical tubers and very small lesions, very small nodules, subependymal nodules on diffusion weighted image and ADC map. Subependymal nodules, red color, these cortical and subcortical tubers, yellow colored arrows. Tuberous sclerosis with some ependymal nodules and cortical and subcortical tubers and possible giant cell astrocytoma. Of course, the sure diagnosis of giant cell carcinoma is enlargement on follow-up studies. On serial studies, you have the enlargement, but the presence of very large mass with enhancement is suggestive. CNS tuberculosis, cortical and subcortical tubers, subependymal hamartomas or nodules, and in some cases there will be a change to the giant cell astrocytoma. Next is 65-year-old male. Here is a on FLAIR image. There is hyper-intense lesion in the brainstem, in the lateral aspect of the brainstem, and here's the hyper-intense on diffusion weighted image, hypo on ADC map. Diagnosis lateral medullary infarction. In clinical history, the manifestation, clinical manifestation, there is what we call lateral medullary syndrome, lateral medullary infarction syndrome. And you have here ipsilateral sensory loss, there is ipsilateral facial pain, there is ataxia ipsilateral, and so on. 65-year-old female. T1 weighted in hyperintense area, hyperintense on T2 weighted image. This is at the quadrigeminal blade cisterna on the left side. Again, on the sagittal sign, still the hyperintense signal in the quadrigeminal blade of the midbrain. Again, the lesion on T2 weighted image. On coronal T1 weighted image, hyper. Here's the fusion weighted image. It is black because there is fat separation in this in this diffusion image. Again, in gradient, there is some fat separation in gradient. Diagnosis lipoma of quadrigeminal blade. As you see here, it is this is an old lady, so this is asymptomatic or incidental finding. 17 years old female. Now there's hyperintense salami bilateral, hyperintensity 2 on T2 weighted image. On diffusion weighted image and ADC map, on diffusion there's hyperintense signal on the salami and basal ganglia, and on T2 weighted image the signal as it changed to the hypointense signal in both salami. Now, on FLAIR image, same hyperintense signal. Look at here, there is hyperintense signal on this T1 weighted image in the transverse sinus and beginning of the sigmoid sinus. Again, there is hyperintensity in the salami, hypointense on T1 weighted image, and on T1 image again there's the signal in the dual sinuses, dual venous sinus. Here is the hyperintense salami on T2 weighted image, hyperintense salami on T2 weighted image. There's this is the MRV. You can see here the transverse sinus flow signal. There's no transverse sinus flow signal, so it is occluded. And now this is the one crucial image, where is the sinuses, deep venous veins here. Internal cerebral veins are not shown. Vein of Galen and straight sinus are not shown. There is no flow signal in them. Again, transverse sinus, no signal. No signal transverse sinus. This is the normal anatomy to compare it with the case. Here is the straight sinus. There is no straight sinus here, and there is no vein of Galen. Vein of Galen normal, and the internal cerebral vein should be here. So this is usually with this type of pathology, there is clot or thrombosis in the dual sinuses or cortical vein, which is not present in this. This is a diagram of the vascular territory of the venous sinuses. Here is elaborated diagram show the drainage of the deep cerebral vein drains this one. So there is venous infarction if there is occlusion of these sinuses. Diagnosis in this case is deep cerebral vein thrombosis and the transverse sinus thrombosis. Deep cerebral vein thrombosis especially the internal cerebral veins and associated cortical vein thrombosis or dual venous sinus thrombosis. Typically, the thalami are bilaterally edematous with potential superimposed venous infarction. Next case, 60-year-old female. There is hyper-intense signal on T2 weighted image and on FLAIR image in this large area. This is in the with involvement of the cortex and subcortical white matter. So what do you think? This is the territory of which artery? This is the middle cerebral artery territory. On diffusion weighted image, it is hyper intense, and on ADC map it is hypo intense, or there is diffusion restriction. This is the how it looks on T1 weighted image without contrast. There is bleeding, there is hemorrhage, hyperintense and some batchy and gyral enhancement on post-contrast study. Again, post-contrast studies is gyral enhancement and batchy enhancement, parenchymal enhancement. So this is subacute middle cerebral artery territory infarction. Next is 39-year-old female. This is T2 weighted image. And here is, what is this? Can you guess what is this? Compare with the other side. There is hypertrophy of the sphenoidal wing in this hypointense area on T1 and the T2 weighted image. After contrast enhancement, there is enhanced tissue strip. There is enhanced strip of tissue here. So this is hyperestosis with enhanced soft tissue, narrow strip of soft tissues, the enhancement on both sides of the greater wing of sphenoid. Again, there is homogeneous enhancement. This is in the coronal image, T1 weighted image post contrast. And again here in the sagittal image, it is exactly applied to the greater wing of T2 weighted image, again with fat separation. And here is the sagittal T2 weighted image, the thickening of the sphenoidal wing on the right side. This is typical site and appearance of the meningioma, in black meningioma. Next case is 66-year-old female. Here there is marginal or rim enhancement with central non-enhanced necrotic areas. Here is again on sagittal, there's rim enhancement and central non-enhanced area. Rim enhanced. The epicenter here is in the white matter. If the mass is large, it will also reach the cortical gray matter, as in this case. So there is a mass here with mass effect, and there is rim enhancement. On MR spectroscopy, here is the choline, increase the choline peak, and normally the NAA, N-acetyl aspartate, is higher. The peak is higher than both the choline and creatinine and creatine, and this is not normal, and the diagnosis is glioblastoma multiforme. Next case is 10-year-old female. Here is what's this structure in that place? Yes, optic chiasm. There's enlarged optic chiasm with no or very minimal enhancement. Here's the chiasm, and what is this? What is this? These are the optic nerve, second optic nerve. So this is after contrast enhancement. Look at here, there is minimal or no enhancement here. Again, there is second optic chiasm, and that end of the optic nerve at the side, central sides of the optic nerve on the other side also, on the left side, and on the right side it is thickened. So again, the optic chiasm enlarged, and here you can see this hyper intense signal also in the brainstem and in the cerebellum. Here again, this is T2 weighted image. You can see there's focal hyper intense areas here in the basal ganglia, and on the other side also, salami and basal ganglia, there is hyper intense areas. Hyper intense areas seen also on FLAIR image. Here is on T2 weighted and T1 weighted image. There's enlargement of the optic chiasm and the beginning of the optic radiation. Here's the hyper intense. There's no diffusion restriction in this ADC and diffusion weighted image. There's enlarged optic chiasm, fundibulum of the pituitary stalk. So this is enlarged optic chiasm with no enhancement. No enhancement of the, or minimal enhancement here, or in the optic chiasm. Diagnosis in F1, neofibromatosis type 1, and visual pathway glioma involving the optic chiasm and both optic nerves, and focal areas of abnormal signal intensity. Focal areas of abnormal signal intensity are seen in the deep white matter and in the basal ganglia or corpus callosum. They are seen as areas of T2 of hyper intensity on T2 weighted image and the FLAIR image with no contrast enhancement. Diagnosis is in F1 with FASI and optic nerve and or optic busway glioma or visual busway glioma. 10-year-old female. There is a mass here inside the spinal canal with large extraspinal component also, and displacement of the spinal cord. You can see here the CSF cap. The cord is pushed to the side, to the right side, and here there's a CSF cap, and there's a CSF cap on the lower ball of the mass. Here's again the mass, and cord is pushed inside the dural sac. You can see here this is T1 post contrast image. This one is less enhanced than the other. This is because of the presence of degeneration, myxomatous degeneration. This is again the CSF cap, and there is a push the cord to the contralateral side. This is the mass, intra and the extraspinal component on T1 weighted image. T1 weighted image again. This is the CSF cap or widened CSF. Diagnosis in this case is spinal neurofibroma. Thank you so much. This is Muhammad Borg from Mansoura University.